The equipment for our total hip patients, the walker, which I just showed you, the raised toilet. Our care management team will make sure you have a raised toilet for when you go home. A chair that is the appropriate height for you. Make sure that chair has a nice level seat. Patients will always ask me about recliners. Recliners are tricky because sometimes what happens is just to sit in a recliner chair, you're fine. But then when you go to recline, what happens is it drops your fanny, raises your knees, and we don't want your knees to go higher than your hips. So be careful with your recliners. Talk to your physical therapist about that. This is the reacher, the grabber. And what it does is it has a long device, so you can hold it here. And then when you pull this, it will allow you to pick things up. And if I had something that I trusted, I'd be able to pick it up. But these you can get at most any store. But with any equipment, I tell people, wait until you've had your surgery and you've gone through physical therapy. Because some people do so well in physical therapy that by the time they get home, they don't need a walker. So keep that in mind. I've had patients go out and buy beds because they're anticipating they're going to be bedbound for weeks. You don't need to do that. We supply the equipment that you need. One of the pieces of equipment for a hip patient is a raised toilet. That's very important because our toilets tend to be too low. So enough said about that. I'm kind of getting off track. So that's your reacher. And then this device is called a sock aid. And what you would do is you would put the sock on here, and then you'd be able to slide your foot in. And it would work something like this. I'm not going to do it, obviously, but this is the sock aid, and you can use this to pull up. Another device we have is a long-handled shoehorn. That'll help you get the shoes on. This actually helps getting your socks off. It also helps getting your pants on, your trousers. And then long-handled sponge. Okay, so those are some of the assistive devices. Your long-handled sponge, shoehorn, and the reacher, and those are actually available here at the hospital, and the PTOT person can help you with that. Now, our total knees who are feeling neglected out there, total knees do not have to follow precautions. However, if I'm a total knee patient and you ask me to bend my leg all the way back, I wouldn't be very happy with you. So you need to be sensible about the range of motion for your knee. Our total knees do use a walker. They will also have an immobilizer on, which is another way of saying a brace on their operative leg. And most of the time that immobilizer is removed on the first day or even the day of surgery if a patient can do a straight leg raise. So there's your motivation for practicing the straight leg raise before your surgery. And then the ice cubes are not for your drink. They are to provide ice on the surgical site, and that's going to help decrease the swelling. Total knee patients have significant swelling in the knee and consequently have more pain than your average total hip patient. So we always want to stay ahead of the pain with the total knees and also with the total hips. But we also understand that the total knees tend to have more pain than a total hip does. The reason being, the knee is a smaller compartment and you have a lot of what I call real estate running through that knee. A lot of muscles, ligaments, tendons, blood vessels, and any swelling in that area is going to put pressure on those sites, and that's what's going to cause your pain. If you had a hip done, you have all the subcutaneous tissue, so the swelling can go into those areas you don't have quite so much pain.